Hey, I'm John Bachman, military physician assistant. 9 years ago, I wrote my master's thesis on the topic of fetal pain. And just before I turned it in, I contacted a worldwide expert on the topic, particularly fetal pain, pain in general, for his input. That man's name is Dr. Stuart Derbyshire. And I kept seeing his work cited throughout practically everything I read on the topic of pain. He's a widely respected, prolifically published cognitive neuroscientist at the National University of Singapore. He's pro-choice. I'm pro-life. He's British. I'm an American. You wouldn't think we have much in common, but in fact, we co-authored the #3 paper of all time at the Journal of Medical Ethics in 2020. It's called Reconsidering Fetal Pain, in which we agree that fetal pain at 12 to 13 weeks gestation is worthy of consideration. Would you agree with that, Stuart? Worthy of
Yeah,
consideration, even if we
sure,
disagree on what to do about it.
sure. I mean,
Okay.
12 weeks is pretty low, but
It's
yeah,
pretty low. We
it's but
agree on
that's the
that.
point. Yes, that's
The
the point at
lower
which,
limit.
yeah, that's the lower limit. Yeah.
Yeah. Yeah, okay, fair enough. So we even agree on that as a lower
Yep.
limit when we talk about pain. Otherwise, we start to blur what it means to actually be in pain. Well, what is your pain level at this present time, Stuart, on a scale of 1 to 10 or 0 to 10?
Right now, I do not have any pain. I'm okay. I'm
Okay.
in a good.
Okay, good.
Yeah.
Good. I just asked my pay. I'm a military PA. I'm not telling you this. You know this already, Stuart. I'm a military PA in Tennessee. Stuart's in Singapore. I ask my patients this question very often, like, "Hey, how's your pain? What's your pain level on a scale of 0 to 10 or 1 to 10?" My pain level, Stuart, would you believe it's a 10 out of 10 right now?
Really? What's going on?
You're so credulous. I expected a little more incredulity.
I mean, my first thought was concern.
Yes. Well, good.
Incredulity would have followed and is now
Yes.
following. Yeah.
Yes. Yeah. Incredulity follows once you see my grinning. I might even play on my phone,
Yeah.
doodle with my pen. But okay, so I'm making a subtle, maybe not so subtle point. Um, okay, so what would you say? How did we start? Like I've told this story probably 50 times, but
Yeah.
I haven't heard it from your perspective. From my perspective, I was trying to turn in my master's thesis, and I had about a month left, and I kept reading over the same stuff. Like Dr. Derbyshire says this, he says this, and I would read you in New York Times, and then in one of those New York Times articles, you seem to be walking back one of the major findings of Royal College of Obstetricians and Gynecologists 2010 report on fetal awareness, what I call the fetal sleep hypothesis. And you said, that's a really attractive idea. Unfortunately, I don't think it quite works. And so I kept reading that. I was like, you know what? I could actually reach out to him and put his response in my thesis. So that's, from my perspective, that's how it happened. You were just going about your day, I presume. Please tell me how it started, our association from your
Yeah, that sounds
perspective.
about right. I mean, I remember the New York Times interviewing me about this topic. And yeah, there were two things they asked that I rode back is perhaps a bit strong, but one was that, in your 2006 paper, you talked about the infant has to be about a year old before it will feel pain. And I was like, yeah, that's pushing it probably too far out. And it depends, always said this, it depends what you mean precisely by pain. If you're talking about a self-reflective awareness, then probably 12 months is a bit early. But if you're talking about some sort of immediate raw feel that we don't have conceptual access to, then that's probably too late. And then they also did ask about the sleep hypothesis, which I was attracted to when it first came out because it is a really neat idea and it does kind of do a total end run around the whole topic. If the fetus is asleep throughout the whole of gestation, well then yeah, we don't feel in our sleep. If you feel pain in your sleep, you tend to wake up. So I was like, if that's true, then yeah, this ends the argument. And I was broadly convinced, but always that snagging thought, we've seen the fetus and it moves, its eyes open, and sleep staging in infants is almost impossible. They don't really behave or look that different when they're sleeping versus not sleeping. In fact, can get really philosophical about it and argue what the hell is sleep until about 12 months old or 6 months or something. It's not clear that the sleep is there. So there was always those issues. But then I was talking to a friend of mine who's an EEG expert, and he was like, "What is this idea?" And I showed him some of the papers, and I showed him the EEG plots. And the big thing is it goes quiet. So when these fetus is stressed, most of us start to wiggle. We become more alert, but the EEG signal shows signs of quiescence. And he's like, yeah, that is impressive, but there's also these massive spikes in it, Stuart. Like, what are those? Are you telling me those don't mean anything? And I was like, well, I don't know. You're the expert. And he's like, well, I don't know what they mean either, but I'm telling you they don't mean nothing. And they ain't quiescent, you
Yeah.
know? It's like, all right, fair enough. Look, it's an attractive idea, but truthfully, we don't know what sleep is. And the quiescence that Mela described is an exaggeration. It's not full quiescence. So I dropped it, and I was just like, really, we don't know the fetus sleeps. It probably doesn't sleep throughout the whole of pregnancy, and so it's back on the table. It doesn't resolve it. It's not the end run that I think Mela wanted it to be ultimately.
Yeah, that was one of, just for our audience who's probably not as in depth with fetal pain as you and I are. That's one of the two main findings, what I would call one of the two main findings of Royal College of Obstetricians and Gynecologists 2010 report on fetal awareness, what I call RCOG 2010 for short. That was one of the findings, that the fetus is always asleep and therefore never feels pain throughout the entirety of gestation. The other one is what I call cortical necessity, which is that the cortex, the brain's outer layer, has to be at least a minimal level of maturation before it can perceive or construct pain, however you want to look at it. And
Yeah,
they said that happened at 24 weeks.
yeah. So I mean, I didn't feel like the OCOG 2010 report leaned that heavily on the sleep hypothesis, to be fair. It
Mhm.
was in there, but the main thing that we leaned on was the cortical necessity and
Mhm.
the cortex being a functional unit and being fully integrated with the peripheral nervous system. That was what we spent most of our time talking about. And yes, you're quite correct. The argument was that before 24 weeks, that it isn't a functional unit and it isn't fully integrated with the peripheral nervous system, and therefore pain before 24 weeks is impossible. That
Possible.
was the bottom line. Yeah,
Yep.
impossible.
And so from the pro-life side, we were getting hammered on both of those. So the fetal sleep thing might not have been a very big thing to you as one of the co-authors of that study, 2010, but from us pro-lifers who were getting hammered on literally everything from that study, we were told that we were espousing pseudoscience, junk science, and so from my perspective, I wanted to know what you thought about it. No, when I wrote you, what did you think? Some random guy?
Well, yeah, I mean, you were, but I mean, I get a lot of emails, about
Yeah.
these kinds of things, and some of them are abusive, and some of them are insane. Yours was neither, so that was novel,
That's high
and
praise. The
you
abuse
you know
came later.
yeah, yeah, sure. You asked reasonable questions. I think I might be making this up, but I think what I remember you asking was sort of what are we talking about when we talk about pain not being possible? Like what is pain basically? And I think that always felt that was a very legitimate question to ask, and we should have asked that louder and more often. And then the other thing you talked about was this issue of cortical necessity, and it's like, I don't buy it. There's good evidence from, I think you quoted probably the Merker paper, that anencephalic babies can, have awareness. They are awake. They do move. There's evidence from their behavior of emotion. So what do you make of that? And at the time, I thought these are reasonable questions, and you're doing a thesis on fetal pain, so I should answer. So I answered.
That's pretty cool. And we just kind of corresponded over the next, gosh, this was, I turned my thesis in 2016. Must have been May when I contacted you. I think I turned it in June. And then I moved to New York, like September to November timeframe. You were in New York doing an
Yeah.
NYU animal sentience symposium. You invited
Yep.
me there and we hung out. We hung out in, at NYU at an after party and then at an animal rights lawyer's home, as I recall.
That's right. Yeah. With the liberated chicken wandering around.
Yes, yes, the chicken wearing a diaper. That stands out in my mind for some reason. Good times. And so then you contacted me. Gosh, it must have been a few months later. I was down at some training exercise in Louisiana, in the woods of Louisiana, and you asked me what I thought were some latest findings on fetal pain. Since I was studying it, you were wondering, and I think at that time is when I was like, I named my thesis as one of the latest findings on fetal pain, and you didn't seem impressed. And you were like,
Yeah,
yeah, yeah, John, okay.
there's plenty of theses out there, John. Yeah. Yeah.
But I stuck to it. I was like, no, no, this is for real, Stuart. And then I said, and I think that's when I confronted you about RCOG 2010. And I basically told you in a very polite way, non-abusive, as you point out, non-abusive way that I thought RCOG 2010 was hot garbage. And you were surprisingly receptive. I thought I might have severed our association at that point, but it was just beginning, as it turns out.
Yeah. I mean, it was a consensus statement, and then the consensus is always a bit problematic. It's not
Yeah.
based on any finding per se. It's based on a select group of people deciding that this is the truth. And
Mhm.
obviously, a select group of people, no matter how good they are, can't decide the truth. So it was a position piece, if you like. And yeah, position pieces can be challenged and should be challenged. So.
Mhm.
You were challenging it. That's fine. And I think I can't remember if the two papers had come out by then. The one that Solomon's was the senior author on, and the one that Ionetti was, I think, senior author on. But anyway, they were about that time they were going to come out. And then there was another paper that I found on what creature was it? I can't remember what animal it
Oh, it
was,
was
but
like ferrets or something.
ferrets. That's right,
Yes,
ferrets, where
yes,
the subplate neurons, the auditory subplate neurons, were fully functional, and
yes.
that was genuinely surprising finding to me. That I did not expect to see that because the subplate was always considered to be a developmental compartment where things sat and waited until the right moment when they could move into the cortex proper and become functional. And it's like, oh, they're not. And that was something Anand had always argued that maybe the subplate neurons are functional. So the functional subplate neurons story plus Ionetti and Tim Solomon's work suggesting that the cortex and the necessity of was being exaggerated. It was like, yeah, okay, we revisit this.
Yeah, and just for our audience, the subplate is sort of an early version of the cortex. At least that's how we're conceiving of it, and that's how others have conceived of it as well. It used to be kind of relegated to just a way station for neurons while they kind of coalesced into the cortex later, or like a waiting area for neurons to hang out while the cortex was being developed. But in fact, what Stuart and I hypothesized was that the subplate may in fact be functional in many ways, just like the cortex, like an early version of the cortex. So if we agree with cortical necessity, then well, maybe we could go with subcortical necessity as well, or some kind of version of it. So at any rate, and the other two papers were Feinstein, I think, 2016, and Ian Eddy was in that as well, or Feinstein and yeah, Tim Solomons and a couple others, where the cortex was active. uh, there was a man with very little cortex, but had heightened pain sensation. In another paper in which the subjects had no pain sensation, but the cortex was active. And so we were saying, well, this is double dissociation here. How do we make sense of this? And we sort of hypothesized that maybe the cortex isn't quite as important in the role of pain as we had formerly thought. Fair enough?
Yeah, that's about right. Yeah,
Okay.
so yeah, those two things we like that it's time to revisit this question.
Yeah, okay. Cool. All right. So philosophically, I'm really interested in the philosophy of pain. That's kind of the approach I took with you early on, and I think you are too. Does pain exist, Stuart?
Um, as an objective, concrete thing, no. It is a subjective sensation, and it's not something you can pick up like you pick up a penny and show it to someone. It doesn't work like that. But as a real experience, sure. It'd be a very strange position, I think, to deny that pain exists.
Hmm. Is this true just for adult humans, or it starts to get a little hazier, doesn't it, when we start getting in nonverbal? We start
Yep.
getting into simpler organisms. We start getting into animals, and of course, very early humans. And that's where we're kind of talking about. How would we
Yep.
know if the fetus could feel pain?
Well, we don't. I mean, you can't know for sure. I mean, I can't know for sure that you feel pain, right? The only
Exactly.
the only person you can know for sure is yourself. And even that you can mess with and say, do you really know your empirical self? I don't know. Kant made this distinction between the noumenal and empirical you. You only know the noumenal you don't know the empirical you, and it gets so you can get really, really complicated and messy. So as an absolute known, no, that's pretty much impossible, I would say. You're
Yeah,
inferring.
and so nevertheless, we do accept it. Well, I don't know. Do you accept animal pain? You argued against fish pain. Do you agree with dog pain? Where's the cutoff for you?
It depends what you mean. So this is where it does get, I think, quite difficult. And that conference that you mentioned in New York, it's where I kind of it was also another tipping point for me. Is like obviously everybody else is using pain in a way that I wasn't. For me, up until really 2019, 2018, pain was always a self-reflective conscious experience. It was as the ISP described it. It's not nociception. It is an awareness. It is self-reflective. It's something that develops along with your other cognitive and emotional abilities from birth onwards, and so it emerges gradually with general conscious experience. If that's how we think pain is, then yeah, it's just us. That's it. There's no means by which you can plug it into an animal. Maybe some higher primates, maybe chimps have some, touching on this, but for everything else, they just are, and they are what they are because they are. There's no reflection on it. But it became clear to me that that's not the way most people think about this, and it's not even philosophers. The way they think about it is that it's some sort of internal signal to control and organize the organism. And I think I've mentioned this before. Like it's a bit insane, wrong perhaps, to say that an animal doesn't see. Obviously, it sees. It avoids obstacles. It searches out things that it's of interest to it. To put it colloquially and broadly. It isn't an accident that a dog will pee on a tree and doesn't pee in the middle of the road. It is organizing itself with regard to its environment in accordance to what its sensory organs are telling it is there. And that's what I think most people mean by seeing, hearing, smelling, and feeling pain. So if that's what you mean, then yeah, clearly lots of animals feel pain. And if that's what you mean, then yeah, it opens the way for the fetus to feel pain in that way as well, as a signal to its internal organs to rearrange its behavior. It's it like when a dog sees another dog and gets excited, I think that's a reasonable way to put it. It does see the other dog. It directs its attention and its vision towards it. It does wag its tail or bark. It is an excited dog package towards another dog package. Is it thinking that dog looks cute? No, I don't think that's what's happening. But is it having some experience of another dog? Yes. Is it conceptual? No. Can it tell us about it? No. Can we access it? No. But does that mean it's not real? No.
Yeah, I like the way you put that. It does seem that dogs in particular, I was just noting this to my neighbor as we were talking about dog shame. The dog,
Yeah.
his dog loves to interact with wildlife, mostly to kill it. But he was
Yeah.
interacting in this case with a skunk. And this
Yeah.
was some weeks ago now, and the skunk still essence still lingers on this poor dog. And we were laughing about how his dog apparently to obviously felt a sense of shame for
Yeah.
being so stinky. And as social animals, this makes a lot of sense. So they have to interact with a pack and they have to, so some sort of emotion of shame, as well as
Yeah.
other social emotions, would probably make a lot of sense. And so I like what you're talking about as dogs recognizing each other. I view it very much the same way. And Colin Klein, philosopher, gosh, is he in Australia? He talks about
Yeah.
how even honeybees
Yeah.
could could be conscious. I don't know if he talks about pain in honeybees, but something as simple as a honeybee. Also a very social creature, it turns out.
He does specifically talk about pain in one of his papers in insects. I can't remember if he isolates a particular insect in that paper, but I mean, again, I have very mixed feelings on this, right? And I
Mm.
do think we have to be very clear what it is we mean, because actually, when it comes to insects, most people would not say that, a bee can feel pain or that a wasp can feel pain. I think
We wouldn't
most
tear their
people,
wings off, would we? We wouldn't tear the wings off a butterfly. Fly maybe, but a butterfly, no.
well, yeah, but that's because a butterfly's too pretty.
One's
So,
pretty, right? But
yeah,
we
yeah,
but we
exactly.
wouldn't we wouldn't chop a frog's legs off because we don't. I mean, why not?
Well, okay, so good to stick with the insects. I mean, we do
Sure,
pull the frog. We do pull wings off insects. I mean,
we do.
and
Yes,
when if a kid pulls the wings off an insect, you might be like, "Come on, don't do that." But
right.
if a kid pulls the ears off a dog, it would be your reprimand would be significantly stronger.
The
So
dog would
we
reprimand this child himself. I
also,
wager.
yes, yeah. So, I mean, we do make distinctions, and I don't think those distinctions are unreasonable. They may be based in intuition, but that's okay. So, our intuition is that insects maybe don't have the sophistication to feel, and I think that's why Colin went for it. Is like, let's see how this works if we follow it through. And the bottom line point he makes is that we have for a long time theorized that pain is kind of part of the motor system. The job of pain is basically to get you to do something else, rest, move, whatever it is. And he's asking the question, well, does the system exist to do the same thing in an insect? And to his general surprise, yeah, there's something there. A fly will adjust its trajectory according to the things that are hitting its senses. It's how it finds a food source. So it'll wobble towards a food source and keep moving based on the odor that's coming its way. And it has a similar system when it comes to sensation, touch and what have you. So in that sense, there's something that pain is doing in that animal. It's moving its behavioral direction. So if that's what we mean by it, then yes. But he's very clear in his paper, very usefully clear, that he said, specifically not talking about a self-reflective awareness. It's not that the insect is considering its destiny and wondering about whether this is the right path and feeling, the pangs of existential pain and changing its course. No, that is
I'm,
most clearly not happening.
I'm a little disappointed, but I accept it nonetheless. Now, so he calls it, as I recall, a homeostatic emotion or a homeostatic impulse, something of that
Yeah,
sort. Just
something like that.
it's a part of self-regulation, as with all the other systems meant for survival. Okay, so it's clear that by that definition, the fetal pain would fall very much within the left to right limits of, from existential angst down to some sort of barely above a reflexive pain,
Yes, yes,
nociceptionism. Okay.
yeah,
Um, okay. So we wrote this paper. It got published early 2020, Reconsidering Fetal Pain. And based on some modified version of the definition, the IASP, International Association for the Study of Pain, revised their 1979 definition, as it so happens, right as we were publishing our paper. So it was it
yeah.
was almost like we planned it. I don't know, Stuart, did you have your tendrils in the
I
IASP's?
did not plan this.
But it did seem pretty fortuitous, right? I viewed it that way. It was kind of coincidental that they took this a little bit more basic definition of pain right as we were publishing, using some version of a simpler definition of pain, a rawer, more immediate experience of
Yeah.
pain. Um, and so we posted what was the fallout? What was the result from your perspective? Because you're in academia and people have certain ideas about what you should and should not think in academia.
Yeah, I mean, to be honest, there wasn't that I didn't feel that much from it, and then to an extent, I never have. I mean, it has been an academic argument for me mostly, and I think also being in Singapore probably made me even further away from it. If I'd been in the States, I think that there might have been a lot more activity and excitement around it, but given that I'm in Singapore, I think that probably took some of the heat away from me. Plus, COVID happened almost immediately as well. So
Yeah.
everybody was locked indoors, and there were bigger things on people's minds. So I
Good
didn't
point.
get, invites to conferences. I didn't get the usual abusive emails. I didn't get, pages of the Bible posted to me, nothing like that. So it was a little flat is the wrong way to put it, but it went for me largely. I didn't notice any great change. I do recognize that it did have a big impact as a paper. It was the number one for a while, and then it was number two, and now, as you pointed out, it's number three. So, that's still a big deal. And the editor of the JME, still recognize it as being one of their biggest impact papers ever. So, in that sort of formal way, yeah, had a huge impact. And I still have friends back home and in the States who will occasionally ask me about it because they see it get quoted. So that's all interesting. But nothing good nor bad happened in a dramatic way for me. So, and I'll probably take that as a win on the whole.
Yeah, I was kind of, I was a little bit paranoid. This was my first and to this date, my only published paper, and you did almost all the work, except I provoked you, I would
Yes,
say, but
you did.
and served as a copy editor for what that's worth. But I was expecting to get a lot of pushback if it ever got published. And I couldn't have been more surprised that it actually got published because it was a radical departure from pretty much everything else before it, from anyone of, from, I mean, okay, so we've had some religious groups positing pain
Yeah,
around 8 weeks or so, which neither of us agreed was really what we were talking about when we talk about pain. I mean, even 12, 13 weeks is the very lower limit. What
yeah,
we don't really know. There's not a lot of research in it, to be honest, and it's just hard to conceptualize what pain would be at that early gestation. Fair?
yeah, yeah.
Yeah. So I was surprised because this was to me a huge departure. It was almost to me when we were discussing, I was like that this seems almost unbelievable compared to what's come before it. Because the lowest I'd seen was maybe 18 to 20 weeks hypothesized. All the fetal pain legislation in the United States was 20 to 22 weeks. So 12 weeks was dramatically different. But I guess our intent was to hypothesize the earliest lower limit, the earliest limit, the lower limit of what's
Yeah.
possible.
I don't think and we didn't overemphasize it, and it wasn't. To me, I don't look at it as a paper that's discussing, time in that kind of way. It's more
Right.
just what are we talking about when we talk about pain, and when is it possible, when is it likely, and that was the spirit in which I wrote it and approached it, and that's perhaps why it isn't as radical as you're suggesting, really. But plenty of people have asked that question, starting with Anand and Hickey in the late 80s. So we're not the first to have asked the question in that way. I think what was new about it was that we brought to bear just some recent, breakthroughs in neuroscience to support our position. Even that, isn't that's not a new thing to do. Everybody does that, right? Everybody uses the evidence they have before them. Again, Anna and Hickey did that in the late 80s. So nothing we're doing is really that radically new, I don't think. I think what perhaps was interesting that I was writing it, I hadn't emphasized it in this way before. But even that, if you look back through all my papers, I've always raised that if you're talking about a raw signal, then all bets are off.
Yeah.
I mean, I don't
You
know
go
when that.
even earlier than 12 weeks. If that's the case, you hypothesize. I mean, what you said because of the reflex, you said even a grub worm or something will bend and roll away from a flame. And if we're talking about
Yeah.
that kind of response, then we could go
Yes.
even earlier because there are peripheral nerves connected somewhere to the spinal cord, developing spinal cord
Yep.
early on. So I don't think either
Yeah.
one of us really considers that necessarily, but you did put it out there. Um,
Yeah. Yeah. I mean, like I say, always depends precisely what it is you mean. You've got to define your terms. So, Mariah Fitzgerald has criticized me for this. Like, well, if you define nociception as pain, then okay, but then you've just
sure.
defined nociception as pain. So, I don't think that's a useful thing to do. And I agree with her on that that level,
Yeah.
like, you know, yeah.
And Fitzgerald was the lead on the update to ARCOG 2010,
I
ARCOG
think lead,
2022. Was that her? Is that an apt description or no?
I mean, these things are strange, right? I mean, for this one, it was on Zoom, so we weren't even in a room together, which I don't think
Uh,
helped. But nobody's supposed to be the lead. We're all
okay.
supposed to be equals, and we are.
Egalitarian.
Yeah, we're supposed to reach some sort of agreed consensus. But I think for sure, Mariah did, I think it's fair to say, took the lead in that committee. She was by far the most knowledgeable and the most experienced of all of us. So that wasn't unreasonable that we deferred in that way.
Makes sense. Now, you mentioned the two papers that really seem to hammer uh, the double dissociation between pain and the cortex. And we've been accused since then, you, not me. Nobody's mentioned my name in this story. We've been accused of misunderstanding
Yeah,
generously or misrepresenting a little bit more pointedly the research
yeah,
that we cited. What is your
yeah.
response to that?
That one did surprise me. I mean, really, it did. Like, t Tim and I've known for a long time, and Ionetti I've known for a long time. I've argued against them for a long time. I mean, I would always said that to talk about the cortex not being necessary for pain has just got to be an overreach. If we understand pain as a sensory and an affective, conscious, subjective experience, and how can you possibly say that the cortex is not necessary for that? That just makes no sense. Even now, it doesn't entirely make sense to me, like that the cortex doesn't matter for our conscious, subjective experience. Come on, it just must. That in some sense, it has to. It doesn't make sense to deny it. But what they did, they specifically argued for many years that we at least were exaggerating the necessity for pain. And that's because pain is a tricky experience. It is salient, it is surprising, it is attentionally demanding. And they were arguing that maybe it's the salience, the surprise, the attentional demands that are really, that the cortex is really responding to, or that the cortex is generating, whichever way you want to put it. But the pain itself is an old experience that sits somewhere in the soup of the brainstem and the subcortical brain. Okay. Like I say, I didn't buy it, pushed back against it, but then they had these two papers, one Roger, who lost his cingulate cortex, lost S2, lost, I think, a bit of S1 and a bit of insula, and, not the entire pain, network. That would take some doing and that would be quite destructive. But he lost a lot of it. And if you'd have told me that there's somebody who doesn't have cingulate cortex, doesn't have S2, has lost insula, bit of S1, will they experience pain in the same way as they did before? I'd say no, no way. Obviously, that experience of pain is going to be altered. I wouldn't be surprised if they had no experience of pain.
Right?
But Roger, yeah, but Roger felt pain just the same, qualitatively,
More.
quantitatively more, yeah, than he did before. So. Well, that's surprising. And then Tim also did the opposite, where he took people who were congenitally insensitive to pain, delivered a noxious stimulus, and they activated the neuromatrix, the cortical areas that we thought were necessary for pain. So clearly, those cortical areas can be activated without pain, and clearly you can have pain without those cortical areas. So that's the double dissociation, and it doesn't prove, I mean, proof is really difficult, but it's very, very consistent with the idea that the cortex is not necessary for some experience of pain. So that's that. I
Yeah.
haven't seen anything like that.
So you found yourself arguing in favor of what their paper said, and they
Yes,
found themselves arguing that you had
yes,
misinterpreted their papers.
yes. It's very, very
Surreal.
hilarious. Yeah, absolutely surreal. Like all of a sudden, they're now arguing my position that there's we never said the cortex isn't necessary for pain. Of course, the cortex has to be necessary for subjective experience. And it's wrong, and this was, I thought, really cheeky. It's wrong to draw an equivalence between what you experience and what the fetus experiences. And I'm like, yes, that is wrong. And I've argued that for flipping ever. You guys, where were you? You know, like when I was having this argument 10 years ago. Now all of a sudden you've decided I'm correct. It's like it was somewhat surreal.
If I don't want to be too on the nose here, and I want to give them every bit of professional courtesy that they are due, if not more. But it seems that there might be some politics in play here. Fair statement?
I guess. I mean, but even then, I'm like, I'm surprised. It's like, why? Like, I've been involved in this argument for a long time, and I am
Right.
a political animal. So, it makes sense that I would do this. But, like, where did this come from? Like,
Yeah.
when did you, and neither of them are Americans, I mean, like, it's been wrapped up in US politics, and I did live and work in the States for quite a while. So, I've got my excuses in, like why I would be involved in this, but I just like you suddenly decide that you're going to oppose, the Minnesota court on this issue.
Yeah.
Weird. Yeah.
Very
So, but yeah,
interesting.
yeah.
Yeah, I talked to Tim, for those who don't know, Tim Solomons was the common denominator between both of these papers. And I asked him, I said, uh, if Roger, this man with greatly diminished cortical apparatus for what we thought would be the pain matrix, some of the key parts of his what we call the pain matrix, he was lacking a lot of that. And so it's surprising not only that he didn't feel less pain, but that he felt more pain. And I asked him, I said, if you weren't able to image Roger with MRI, he said, that's correct. I said, why not? And he said, which I knew the answer, and it was because he was moving around too much when he was in pain to get a clear image via MRI. And I said, so you couldn't get an image of his brain to tell what was lighting up versus not lighting up. And we know the cortex also suppresses pain, it narrows the perceptions as well, not just enhances or enables them. So I said, so what would you have done if he was your patient, what would you do? Would you treat him for pain? If he had no cortex at all, how would you treat him? And he said, well, I would treat him for pain. I was like, even if he had no cortex? He said, yes. And I was like, okay. So that's really what we're talking about. How do we know what parts of the brain are necessary for pain experience? Well, we have to ultimately go by their behavior and whatever other markers we can, whether it's lab tests or imaging or and imaging is just one piece of the puzzle. Self-report is one piece of the puzzle. We can't go with any one variable. We can't get trapped in the univariate crap. We have to go multivariate, I would say. Fair statement?
Well, I mean, I've always argued, and I think this is fair, that if you've got self-report, it's by far the best possible marker of pain that you could ask for.
How do we know?
Unless, hmm?
How do we
Well,
know? I mean, I'm in 10 out of 10 pain, Stuart.
yeah, but unless you're lying, like so
Yeah.
that's the problem. Sure, people
Yeah.
can be malfeasing, people can lie, but unless you've got a reason to believe that the person is being dishonest, then there's
Or just expressing it differently due to cultural reasons, due to gender, culture, all these different things do come into play.
they do.
Situation.
But there is cultural variability for sure, but I don't know anywhere where childbirth is painless. We used to believe that it
That's true.
was, but then we discovered that no, it's just that people didn't speak Swahili who were doing the studies, and the ladies were very much in pain, but they also didn't have access to decent healthcare. They had to work in the afternoon, so they figured there was no particular reason to complain about their pain, especially to this strange white fella who just turned up and is speaking not their
It's
language.
like,
So,
get out of
so
here.
like everywhere where you have open heart surgery, it requires a general anesthetic, and good luck trying to do it without it. So there are clear, I mean, to some extent, this is what also changed my mind on this. That there is an objectivity. You asked about this right at the beginning. There is an objectivity to pain. It's not arbitrary that pain and injury are associated. That doesn't make sense. So yes, the amount of pain that you feel when you get injected versus what I feel, that may vary. but probably both of us are going to feel pain. I hit my hand with a hammer, it's going to hurt. John hits his hand with a hammer, it's going to hurt.
Hmm.
It, we might handle it in different ways. We might have a slightly different quality of experience, but we're both going to be in pain.
Well said. So I want to wrap this up here shortly, but I want to know, where do we go from here? Now, you think that fetal pain, there's no way to be certain about fetal pain, and I agree. But is certainty the standard, and if so, why?
Yeah,
Can we be reasonably certain enough to act? And what would enable that reasonable certainty?
yeah. I mean, I suppose that can we be certain? No. Do we need to be certain? No. I mean, what do we mean by need, right?
Mhm.
Um, so I in the way that I've tried to cut through it is to ask, well, what's in the long-term best interests of everybody involved? And when it's a therapeutic procedure, it's straightforward. Like it's long-term development, it's long-term outcomes. That's what we want to look at. It can be hard because, especially when you're talking about fetal interventions, because they're kind of bespoke, they're rare. You're not going to do clinical trials, so it gathering that kind of evidence is not going to be easy, but it's not impossible. So I think that's where I would try and place the standard. Like, can we somehow work our way through the weeds to figure out what's the best thing to do in terms of long-term outcomes? And that I would basically say that should be the approach.
I'm raising my eyebrows when you mention long-term outcomes in the case of abortion. Now, as far as therapeutic
Yes.
fetal surgeries, without question, it does seem that fetal anesthesia is the standard for long-term
Yeah.
fetal outcomes. Fair?
Yeah. Yeah. Yeah.
For at least significantly invasive procedures.
Well, I mean, it kind of is. I mean, it's not easy to get clarity on this, and I think not for bad reasons. I mean, most surgeons will prefer to use an anesthetic. It keeps the fetus still, and it keeps their physiological environment more stable. And generally, those are better for surgery. And generally, we find it easier, even if it isn't better in terms of long-term outcomes. So.
Papillon will do the same thing, though. Papillon will keep them completely still.
Yeah, but it won't keep the physiological environment stable.
Why not? Because they're probably a lot of
No,
stress hormones pumping through, right?
yeah, that's right. There's definitely a stress response to injury. I mean, there's no question. Like I
Yeah.
say, you bash your hand with a hammer, you will feel pain, but also you'll have, big jump in cortisol, a big release of beta endorphins, your heart rate will go up, your blood pressure will go up, and so on. I mean, it's like there's a clear and necessary, perhaps, physiological response to injury. And controlling that response generally makes the surgery go better, and we think generally that means long-term outcomes are going to be better. And that's not an unreasonable line of thinking. I would offer is that I think if we can come up with more evidence of this, then that's not a bad thing to do. Let's do that.
What
In
would
other
that look
words,
like?
uh, so, what would that look like? So, depending on what the surgery was, but like basically a more comfortable human being in the future. Uh, why am I reluctant to put, like clear lines on this? Because I'm thinking, your IQ will be higher, you get better grades at school, you'll have more friends, you'll be better able to get a job, you'll be a more productive member of society. It's funny that I'm reluctant to make it that concrete, but that is what I mean. Yeah, those
That's fair,
kinds of
but
outcomes.
in the moment, like a pain scale, we have visual pain scales for infants, nonverbal. We even have them for animals. Veterinary medicine uses them. By the way,
Yeah,
animals have this in common with fetuses, that until at least the late 1980s, were not routinely anesthetized for even the most
yeah,
invasive surgeries, which is interesting in the context of what we're talking about, because these unfortunates also experienced only reflexive responses to injury, to tissue injury.
yeah.
So that's the context in which I'm asking this question. I don't want to belabor this, but I'm sure that you see my point.
No, no, I mean, actually, I do think it's worth belaboring. I mean, I think this is the sharp end of it. We should try and figure this out and spend some time with it. Um, I, what I'm I think the reason why I'm going for those objective sort of long-term outcomes is because they're concrete and we can make some decisions based on that if the data is good enough. And I think to be fair, most of the infant anesthesia and probably animal anesthesia too, I haven't looked at that, but is based really on the fact that long-term outcomes were better when you used a strong anesthetic regimen. The infant lives more likely. The infant has fewer complications. So in that way, that's the it's very concrete, and that's the reason really why we introduced anesthesia and analgesia. Imagine if it had gone the other way. If more infants had died in the anesthetic analgesic arm, then we would. There's no way we'd be anesthetizing infants. And people might say, "Well, it looks really painful and uncomfortable." We say, "Yeah, well, perhaps it is, but we want the infant to live. It'll get over the suffering." So I think there's a cheat got snuck in the 80s. That I don't think Anna and Hickey should have written their article about pain. They should have written it about a stress response, and then it would have been straightforward. Reducing the stress response is good for the infant, so let's do that. Fine. Who's going to argue with that?
Right. It
Then
did
the
introduce a little bit of overlap, shall we say, in terms that could be confusing or exploitative or whatever.
Yeah, yeah. I mean, they introduced an emotive term that I don't think was necessary to do the work that they wanted to do. They would
Right.
have revolutionized infant neonatal care without it. So
Mhm.
I just don't quite get that. Then,
I
of
will
course,
say,
the other.
oh, go ahead, please. I'm sorry, I didn't interrupt.
That's okay. I mean, and as I say, the other really sharp point, which I guess we'll eventually get to, is yes, in a termination and abortion, there is no long-term outcome for the
Right.
fetus. So then
Right.
the only reason we will provide fetal pain relief is because we want some comfort in those last moments for the fetus. And there, certainty is the wrong term, but we would like some sort of assurance that it's actually beneficial. And I just don't see where we will ever get that. That seems to me an impossibility. So then what do we do? And I don't have a good answer to that question at this point.
Fair enough. I agree with all points made so far. We could have kept Anand and Hickey in their 1986, maybe 1987 paper, Pain in the Neonate and Fetus, which was a seminal practice-changing paper, after which it became standard to give neonates anesthesia, which they had been denied up to that point as a matter of course, given only Pavulon, which is a neuromuscular depolarizing agent, and oxygen, typically maybe a little light anesthetic or something like that, very, very mild for like open heart surgery, patent ductus arteriosus ligation. So stuff changed after that during our lifetimes, very much during our lifetimes. Uh, so you're talking about something similar for the fetus, which I suspect is not likely to occur. No study like that is forthcoming that I know of. My final question to you, though, is we that certainty is likely to be elusive, but we know that opioids and probably, which I don't know why we're not talking about ketamine here in a lot of different areas, but ketamine seems to be a great option. But let's just say opioids, some kind of strong anesthetic, amnestic. Why we don't give it even if we're not certain, because we are certain that it decreases stress hormones, the stress response, all these markers that we would normally interpret as signs of pain in an adult human or an animal. We don't and make that same inference to the fetus. Why not?
I mean, the straightforward answer to that is that there is no long-term outcome for the fetus, obviously, in an abortion. So there's no particular reason to be concerned. Well, there is no reason to be concerned about the future infant because there will not be a future infant. So that the patient in that circumstance becomes the pregnant woman. And anything that makes the procedure more difficult, more onerous, less good for her, is essentially considered inappropriate. Now, am I 100% comfortable with that? No. But do I understand the logic of it? Yes. So that's why I would look for, well, what concrete evidence could we find that this is truly beneficial for the fetus in a meaningful way? And I come up short, I don't, maybe we never will have that. I don't know. That's something that I'm still, twisting around in my mind.
Yeah, that's the tension in abortion, which clearly does not benefit the fetus, and
Yeah.
the anesthesia, which we would hope would benefit. It's that what Martin Luther King Jr. called dramatic tension, and I think that's what pro-lifers are getting at a lot with this emphasis on fetal pain and anesthesia. So we're at that crossroads there between benefiting the fetus and not at all benefiting the fetus. That makes sense. Any final thoughts, Stuart?
I mean, I've always felt that this is not a good argument for the pro-life crowd, like, because it, what are you going to win? You're going to win that the fetus gets an anesthetic before it dies. But it doesn't feel like me much of a victory. I've got to be honest, like so. I've always been a bit puzzled as to why this is the hill that you're choosing to fight on. I mean, I don't know if you're going to die on it, but you know what I mean. Like, what's this hill about for you?
hmm Do you want my perspective on that? Because
Oh
I
yeah,
can give
no,
you mine.
definitely.
Okay.
Yeah.
And I don't want to, this conversation could go on a lot longer given our backgrounds and our friendship. But I would say that fetal pain, I think you and I agree on this, by the way. Correct me if I'm wrong. Any time we're talking about the fetus in the context of abortion, abortion kind of it's a detraction. Anytime we talk about the fetus, it's not good for abortion. Is that fair? Like, how does a
I
fetus feel?
I mean, I get your point. If that's what you're trying to, it's a wedge issue, like
Yes,
the
it's a wedge.
yeah, yeah. I suppose I kind of feel like that's a bit cynical. That's my
Sure.
problem with.
I agree.
Yeah.
I agree. If that was the extent of it, there is a practical and there's a moral component for me. And I get this from both sides, by the way, not just the pro-choice side, which typically denies the existence of fetal pain. So to your credit, you acknowledge the possibility, even if you don't think it's that meaningful a possibility. But pro-choice side typically denies fetal pain pre-viability for sure, if not any time in gestation. The pro-life side typically says it doesn't matter whether or not the fetus feels pain, abortion is still wrong. And so I'm caught squarely in the middle, and for that matter, so are you in a way. But I would say all pain matters to me. I'm a PA. I treat one of the main complaints that people come into me and to physicians and to clinics in general is pain. Pain is one of the possibly the number one complaint of all of them. The thing that ties all visits together just about is pain. So I treat pain. It's considered immoral, if not unethical, and definitely unprofessional not to treat pain unless otherwise indicated. So there's that. I care about them also. So professionally, personally, I care. Morally, I care about pain. Philosophically, scientifically, I find it an intriguing proposition. I think it's reasonable to consider. And finally, there's the part of it. You may be familiar with Josiah Wedgwood's medallion, anti-slavery medallion back in the 1700s that grew in popularity. It depicted a slave on his knees holding up his shackled hands, his wrists, saying, and the inscription read, "Am I not a man and a brother?" So what that did for slavery was it brought the slave into the spotlight as opposed, and instead of shoving him down into the subhuman, it rehumanized what had been dehumanized. And from a pro-life perspective, and I don't think a lot of pro-lifers recognize this, and perhaps pro-choicers reflexively recognize this in denying the pain outright. I don't want to, I'm sure they have their own scientific objections, but for me, fetal pain, just the question of asking the question of fetal pain does rehumanize the fetus. And I happen to think that there are good reasons to think that the fetus does, in fact, feel pain, and I want that pain treated,
Yeah.
even if
Okay.
it's just for the last few moments of his or her life.
Yeah. Yeah. I mean, I get that. I had some objection that's wandered away from my mind though. Yeah. Okay, so that. I think your overall approach to pain is actually a little bit problematic. I mean, I've dedicated my life to studying pain, and I don't think it's the most important thing. I don't think a pain-free life is a possibility or even a desired existence. There's nobody who's going to get through this life without suffering. So I'm not quite so on side with you that like it's our moral duty to always treat it under all circumstances. I think sometimes it's just gonna hurt, man, and you're
Just
gonna
got to
have to.
tear that leg off, and you know what? Pain is the patient's problem.
Yeah, I mean, I was trying to. I wasn't dragging it down to that, like. Have you read Sullivan and Ballantyne's book on the opioid crisis?
No, Sam Quinones. I've read his, but I have not Valentine's.
Yeah, you should read it. It's sobering. If somebody was in the middle of the arguments that led up to the opioid crisis, because we want to blame it all on Purdue, but we
It's
created.
physicians. It's
Yeah, well,
physicians.
we made pain a central concern of medicine, and
Yep.
I think that was a mistake.
Yep.
I don't want doctors to ask every patient, what's your pain from 0 to 10, because that makes them focus on their pain and also raises the idea that we're going to fix it. And truthfully, most of it we can't fix it. It's just it comes with living, man. That's the way it is.
Seems like we're back in some ways where we began before we discovered anesthetics in that regard,
Yeah.
because pain is like salutary, pain is redemptive, pain is pure is curative.
Yeah, well, we
But
lost all that. Yeah, we lost all that. I mean, and I don't want to argue that surgery is necessary suffering and you should just suck it up. Like
right.
general anesthetic, absolutely magnificent breakthrough.
Maybe for
Opioids,
you, but not for me.
yeah, and opioids too. For
Yeah,
acute post-surgical pain, sure, it makes sense, but for everyday aches and bumps, and even for not every day, but long-term complicated problems, disaster.
yeah.
Doesn't work. It does become necessary suffering again.
Yep. Well, I think we largely agree on that point. So, with that, this seems as good a place to end this recorded portion of the conversation as any. Stuart, it's been a pleasure catching up with you again, hearing your thoughts. I'd love to catch up with you again in this or any other context. Invite you over to lovely Clarksville, Tennessee at your leisure.
Yeah, one of these days I should get back to
One
the
of,
States.
one of these
Yeah,
days.
yeah.
All right. Well, I appreciate it, Stuart. Godspeed to you, and may we talk again soon.
Yep, absolutely. Cheers, John. Good to see you, man.
Cheers.